Good morning everyone, I am Bacleon from BSN 111E and today I'm going to perform Thorax assessment return demonstration. So prior to conduct the procedure, first I'm going to review my client's previous medical record, which is to identify my patient's instances of harm, its medical history, and current treatment procedures. So next is to determine the scope of assessment, which would today include the material and your thorax and lungs using inspection, palpation, percussion, auscultation, and of course to prepare the necessary equipment that are needed. So these are the skin marker, ruler, and the stethoscope. Third thing to do before conducting the procedure is to perform hand hygiene to deter the microorganism and protect the patient and also myself from infection and cross-contamination. So now I'm going to introduce myself to the patient. Good morning, sir. I am Bacleon, your student nurse from Davao Doctors College. So, sir, may I see your wristband, sir? Okay, thank you. So, please state your complete name.
I am AJ Limoko.
And your birth date?
On August 4, 2004.
Okay, thank you po. So, now, sir, what would you like me to call you po?
You could call me Sir EJ.
So, Sir AJ, today I'll be doing a thorax assessment, which means that I need to ask you to stand up and sit down, to take off your shirt, and of course to palpate your or touch your upper extremities. Will be that alright?
Yes, it's fine.
Okay, so after that I will close the door for the privacy of my patient and adjust the temperature so that my patient will be comfortable. Okay, adjust the temperature. Is that okay, sir?
Yes, it's fine.
So, sir, can you take off your shirt now? So, after the patient is now taken his clothes off, now I'm going to palpate, sir, your trachea. Okay, thank you. So, after that, I'm going to check my patient's fingernails for any signs of respiratory distress or problems of oxygenation. So, sir, both hands, please. Do you have any difficulty of breathing, sir, or shortness of breath?
None.
Thank you. I see, it's normal. Thank you, sir. So, okay, now I'm going to ask my patient to stand up so that I can observe the position of scapulae and the shape of the and configuration of the chest wall. Also observe the three normal curvatures. One is a cervical, thoracic, and lumbar. So, sir, can you please stand up? First, here, sir. I see your chest, sir. Okay. Sir. So, I see that there is no abnormal curvatures in his back. So, after that, I'm going to ask my patient to bend forward at waist level and assess to the lateral deviation of the spine. So, sir, can you please thank you. Thank you. So, I'm just looking at any deviation of any abnormal curvatures of your spine, and which is the patient don't have. So now I'm going to assess the temperature and integrity of back skin, and I'm going to ask my patient to sit down. So, sir, please sit down. Please back here. So after that, I'm going to palpate the thorax area for bulges, tenderness, or abnormal movements using my both palms over the lower thorax with thumbs adjacent to the spine and fingers stretched laterally. Sir. so after that, I'm going to palpate for tactile firmitus, and I will ask my patient to repeat words 1, 2, 3. So, sir, if please repeat 1, 2, 3 if I touch your back, sir.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so now I'm going to ask my patient to bend the head and fold arms forward across the chest. So, sir, bend forward. So now I'm going to percuss the posterior thorax. So now I'm going to use a percussion to measure the rheumatic excursion. Can you deeply inhale, sir, and hold it? Exhale, sir. Okay. Now inhale, sir, deeply, sir. So now I'm going to auscultate for breath sounds using the systematic ladder pattern. Now I'll be listening to your breath, sir. So I need you to inhale, exhale. So I'm going to use my stethoscope. So after that, I'm going to ask the client to repeat the phrase 99. So sir, can you please repeat 99, sir?
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, sir, can you say letter E and repeat it, sir?
E. 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 E.
Okay, thank you. So now, sir, can you please whisper 1, 2, 3? So now I'm going to inspect the breathing pattern and costal angle. So sir, can you please lay down in the bed, sir? So now I'm going to inspect the breathing pattern and costal angle. So sir, I will palpate, sir. Check for temperature. Please inhale, exhale. Thank you. So alright, now I'm going to percuss the anterior thorax systematically. So after percussion, the thorax of the client, I will now auscultate for anterior breath sounds, adventitious breath sounds, and voice sounds. So sir, can you please inhale, exhale for me, sir? Okay, so now to sum up, I will get my okay sir, you can now adjust yourself. Okay sir, to sum up everything that we discovered, so your spine is vertically aligned and straight, and while palpating with your anterior and posterior thorax, the skin is intact and temperature is uniform, no tenderness or masses. While listening to your breath sounds, it was also normal, and your breathing pattern is quite rhythmic and effortless respirations. So basically everything is normal. So thank you, sir, and thank you for cooperating. So after everything that happened, I will now do the hand hygiene.